Hello friends, welcome to my channel A.P.S School of Excellence. In the continuation of our hematological series, we'll be learning today about ESR. Our chapter 4 is ESR. ESR is Erythrocyte Sedimentation Rate. Now what is ESR? ESR is rate at which the erythrocytes settle down. And what is the importance of measuring ESR? Remember friends, ESR is not a diagnostic test but tells us the prognosis. Means it does not tell us about that the patient is having either tuberculosis or rheumatoid arthritis or any infection, but it tells us the prognosis. Prognosis, what is prognosis? As we all know, prognosis means monitoring of the disease and the response of the patient to the therapy. So that ESR tells when to advise it. We have to advise it from the first day when the patient comes to us. Whatever investigations we suggest to the patient, we advise to the patient for making a diagnosis of the disease. Plus, we have to advise ESR. And how it helps, we'll be advising ESR in further treatment. And if the ESR comes decreasing, that means the therapy what we are providing to the patient, what we are prescribing to the patient is right. Now, what are the normal values? We measure ESR in mm in 1 hour. Means in 1 hour, how much erythrocytes have been settled down. So 0 to 9 mm in 1 hour is normal in males, 0 to 15 mm in 1 hour in females, and infants it is less, that is 0 to 5 mm in 1 hour. This is by Wintrob method. We can measure ESR by two methods. One is Westergreen method and second one is Wintrob's method. The most commonly used method is Wintrob method. So we are seeing the values by Wintrob's method. Now, what are the conditions in which ESR increases? As ESR can be increased or decreased, but we have already seen the values starts from the 0. So we are to see what are the conditions in which ESR is increased. There can be two conditions, physiological and pathological. There are mainly two physiological conditions in which ESR comes raised. One is the menstruation and second one is the pregnancy. So always remember, ask your female patient, is she menstruating or not? That is important to us to advise ESR. If she is already menstruating, so ESR will come raised. It will not have any significance to us. And second one is the pregnancy in which ESR comes raised. Then now comes to the pathological conditions. Pathological conditions, these are all the pathological conditions in which ESR get raised. First is acute bacterial, viral or fungal infections. Second one is acute inflammatory diseases, chronic bacterial fungal infections, SLE is systemic lupus erythematosus, Sjögren's syndrome, multiple myeloma, tuberculosis and all types of anemia except sickle cell anemia. In sickle cell anemia, ESR does not raise. Next one is the malignant tumors. In all the malignant tumors, it comes raised. Next one is RA. RA is rheumatoid arthritis, rheumatic fever and liver diseases. And always remember, the diseases like tuberculosis and malignant tumors, the ESR come raised even above 100. And now, as I already told you that we have to measure ESR at every point of the treatment so that we can know about our treatment is going right or not. If the ESR is come decreasing, that means our treatment is right to the patient. So that is all about ESR. Thanks for watching this video. If you like this video or if this is helpful to you, please share, like and subscribe to my channel. And you can get your notes from the blog given in the description below. Thank you so much.